Fitchburg City Council. I now call this meeting to order. Please be advised that FATV is conducting audio and video recording of this meeting for public broadcast. I ask that anyone else in the audience who is recording this meeting to please stand and identify themselves for the record now by stating their name and city of residence. Seeing none, I ask that all electronic devices be placed into silent mode. And Councillor Green, would you please lead us in the salute to the flag?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk, would you please call the roll?
Councillor Green.
Here.
Councillor Schultz.
Here.
Councillor Van Hazinga.
Here.
Councillor Walsh.
Here.
President Zarella.
Here.
Councillor Boschman.
Here.
Councillor Kuchar.
Here.
Councillor Cragen.
Here.
Councillor Cruz.
Here.
Councillor Di Natale. Councillor Fleming.
Here.
Welcome back, everybody, and that is 10 members present.
Thank you very much. There is currently no one logged in to Zoom for public comment. If anyone in the audience would like to participate in public comment, you may approach the center podium, identify yourself by name, city of residence, and the agenda item on which you wish to speak, and you will be given not more than 2 minutes to do so.
Jacqueline Wetchy, Fitchburg resident, 157-24. There are several problems with this ordinance. First, riders are prohibited from wearing masks. Just as I should not be forced to wear one, they should not be denied the right to. Masking should always be a matter of my body, my choice. It has been the city's practice to not enact ordinances on items under actual or potential litigation, an example being chickens. And the city has a years-old MCAD complaint open on masking. Second, no one should have their property rights infringed on. ATV owners should be able to use their vehicles on their own land. Additionally, there should be no limit on how many vehicles an individual may own. Imagine a whole family likes to go off-roading together, and now you deprive them of that, even if they load their vehicles onto trucks and go out of town on legal trails. Third, prohibitions don't work. A better solution is to provide a place for people to enjoy this hobby. Recently, I traveled to Guilford, Maine, where it appears the only thing most people do for fun is ride dirt bikes, ATVs, and snowmobiles. Yet there were none on the public roads because they have an extensive system of trails. They even have a rail trail for these vehicles. Our rail trail is one of a dime a dozen. Imagine what a unique tourist destination it could be if we turned it into a motorized vehicle trail. You will say that would deprive walkers and bicyclists of the trail. I went on it once and never again, walking past 5 people hanging out under the 5th Street Bridge with the dirty old mattress was not inviting, not to mention all the other unhoused encampments I saw. And it's not just me. The police bought a fancy UTV to patrol the rail trail, but they're not going there. But riders of dirt bikes have the risk-taking gene. Let's give these riders the rail trail and solve this problem creatively. And on 163-24, we don't need a new bureaucracy.
Any further public comment at this time?
Good evening. I'm Charlene Blackso, 31 Gloria Ave, and I'm here as a representative of the Shea Street Neighborhood Group. I would like to speak in favor of 09824, which would be the solar moratorium. Although our neighborhood has a stake in this, it really is of benefit to the entire city. We're not asking to ban solar, we're just asking for a pause so that the city can take the time to write responsible regulations which will encourage responsible siting of these large-scale arrays. We all agree that solar is necessary. Again, we're not asking you to ban it, just to slow it down. So I would ask you to please vote positively and pass this moratorium, temporary moratorium. Thank you.
Thank you.
Evening, my name is Kim Goodwin. I live on Mountain Laurel Lane in West Fitchburg.
and I'm here to speak on 030-24 regarding the offensive odors in West Fitchburg. And if I could, I'd like to reserve my right to come back to discuss this after the Board of Health report is given. There has been improvements on it, but as of the beginning of the week or the end of last week, it's back in full force again. So the smell or the odors were improved, but now they're back to where they were, if not worse. So it's still a problem. It's not been resolved.
So I'm pausing your time to address your question. I cannot allow public comment in the midst of the meeting.
Yep.
But if you'd like to use the rest of your time now, you certainly are welcome to do so.
Yes,
or there will be, I'm sure, future opportunities to address this
I'm sure,
as we
because
continue to take care of it.
this topic is still not resolved, so I'm sure that there's going to be more conversation on it. I did see some of the meeting notes from the Board of Health on August 8th, and that painted a very pretty picture that everything's under control and everything's well on schedule. And if you just gone up to the neighborhood 3 weeks ago, you would have agreed with that. As of the end of last week, the beginning, and all of this week so far, it's been awful. So it's not resolved. So still needs attention by the city to get this resolved. Thank you.
Thank you. Any further public comment at this time? All right, we have announcements. The next meeting of the Widowed Helping Widowed Support Group will take place on Thursday, September 19th, 2024, from 4 until 5:30 p.m. in room 205 at the Fitchburg State University Recreation Center, 130 North Street. Kelly Lynn and Bernie Schultz will co-facilitate the meeting. Fitchburg Ward 1 City Councilor Bernie Schultz is hosting a Ward 1 community meeting on Monday, September 9th at 6:30 p.m. here in the Legislative Building. City Councilor at Large Sally Cragen and Public Library Director Deb Hinkle will make presentations and answer questions following. Registration is now open for Second Chance Animal Services for the Jeffrey P. Stevens Low-Cost Pet Vaccine Clinic on Saturday, September 14th from 9 to noon at the Fitchburg Fire Department Headquarters, 33 North Street. Lily from the clerk's office will be present to register dogs owned by Fitchburg residents. License registration is $9 for spayed and neutered and $15 for intact dogs. Rabies and distemper vaccinations are $5 each. The vaccine clinic is open to pets in all towns. Advance registration is encouraged as there will be limited availability for same-day registration. You can go to secondchanceanimals, one word, .org to register your pet online. Stratton Players announces their 99th season, which opens with an original play called Fast Forward Fairy Tales on Thursday, September 12th, 7 p.m. at the Leominster Library. Answering the question of what happens after Happily Ever After. This is a staged reading with actors, costumes, and props. Admission is free and the show is appropriate for kids and adults. The Friends of Fitchburg Cemeteries is a new group that has formed to create a nonprofit organization to assist the city of Fitchburg in supporting our historic city cemeteries. 2 events are coming up. These are a Listen to Nature tour and visit historical local graves on Sunday, September 22nd, starting at 6 p.m., rain or shine. You meet at the pond at Forest Hill Cemetery, where you can park in the lot on the corner of Mount Elam and Electric Ave, Mount Elam Road and Electric Ave. You should bring a journal or sketchbook and a camp chair for the first part, and wear sturdy shoes if you wish to go on the grave tour. The second event is the Thurston Consort at the Forest Hill Abbey, otherwise known as the Mausoleum at Forest Hill Cemetery. On Saturday, October 5th at 2 p.m. Seating will be limited. For more information on either of these events, email friendsoffitchburgcemeteries@gmail.com. That's Friends of Fitchburg Cemeteries, all one word, @gmail.com. Next, we have the report of the Committee on Records. Councillor Walsh.
Thank you, Mr. President. We've reviewed the records, and they appear to be in order.
Make a motion, we accept.
Second. I have a motion and second to accept the report of the Committee on Records. If there are no objections, it is accepted unanimously. We have 4 new communications from Her Honor the Mayor. New appointment of Mike Amadeo as a member of the Fitchburg Cultural Council, term to expire September 17th, 2027. Daniel Dow, Fitchburg Cultural Council, term to expire is September 17th, 2027. Jennifer Hemingway, Fitchburg Cultural Council, term to expire September 17th, 2027. And Liliana Gomez Fernandez, Fitchburg Cultural Council, term to expire September 17th, 2027. Those all stand referred to the Appointments Committee. Next, we have a report by the Board of Health. Is there anyone here to make that report? All right, it is linked in the agenda. I don't know how many councilors have had a chance to look at it yet. If there is a desire to hold it for further presentation at a future meeting, we can do that. Otherwise, it will be on file with the clerk's office. Councilor Green.
I would like to have somebody either from our City Board of Health or the Board of Health Board of Directors here to explain what process and progress has been made and what they're going to further do to eradicate the problem, not just read on a link. I want the public to know what is happening. I mean, they've been more than patient, so.
Councilor Kuchar.
Thank you. Considering that this is my petition, not only would I ask that this get put on for the next meeting for a full presentation by Mr. Curry, but I would also suggest that in order that a representative from Griff Paper should be in attendance as well.
All right, we can encourage that. Obviously, we can't mandate it, but I would certainly concur that for my part, I would look far more favorably upon a scenario where they do actually send someone and show up to discuss the situation. Do I have then a motion to hold?
Make a motion, we hold.
All right. Do I have any objections? I have a motion and second to hold for a future meeting in the anticipation of having representatives of the Board of Health and Grief Paper present. Do I have any objection? All right. It will be held. Finance Committee met yesterday, September 4th. Took up one item, 16024, a loan order that $12,700,000 aggregate amount is appropriated for the following projects, including all costs incidental and related thereto, which amount may be apportioned to such projects as needed to accomplish the projects. With the leave of council, I will summarize the remainder of the loan order. There are 3 items, or 4 items technically: the Meeting House Gatehouse, the Mare Meadow Pump Station, the Main Street water main replacement, and the Regional Water Treatment Plant roof replacement. 3 out of those 4 are mandated by DEP to be completed by the end of next calendar year. And the last one, the Main Street water main replacement, is simply very necessary because our Main Street water mains are nearing 150 years old. And we want to get that done before the Main Street repaving is completed so that we don't have to dig up new road and waste what little paving money we have. So this is all, we heard from Deputy Commissioner DeLine, who said that all of the expense of this loan was included in the previous rate study and will be covered wholly within the enterprise fund. This will not require any loan service from the general fund. Nor do they anticipate needing to raise rates beyond anything already projected to cover this. Any questions from councilors? Councilor Green.
The wording of this when it makes reference to expected to be used in addition to certain American Rescue Plan Act funds, do we know what portion of that money is coming to or from the American Rescue Plan?
So all the numbers in this loan order are independent of that. The money from ARPA is a separate amount that was already appropriated. It's not listed here.
Okay.
So it's not that a portion of the $6 million is coming from ARPA. It's that there's $6 million plus what was already appropriated from ARPA.
5 million. I believe Deputy Commissioner DeLine said it was $5 million.
$5 million.
Yes, so total of approximately 11. I did also mean to note, and thank you for bringing up these numbers because it reminded me, Deputy Commissioner DeLine also noted that for the reconstruction projects, basically everything except the main street water mains, so far all the bids are coming in low, so he does anticipate coming back to us in a few months or maybe half a year to rescind some of this loan authorization as unnecessary. It's just better that we authorize the higher amount and then rescind it, than authorize a lower amount and have him come back to us and say, we need money. Further questions? All right. This would be first reading of 2 on this loan order, if approved this evening. Do I have a motion? I have a motion and second to pass this loan order through its first reading. Do I have any objection? All right, passes unanimously. Report of the Legislative Affairs Committee. We met earlier this evening, took up 4 items. We took them out of order, but I'm going to just go in order for the report. And I see Councillor Fleming's hand. I'll get you as soon as I begin here. 27023, Councillor Fleming, on behalf of Ward 5 residents, to relocate the election polling site either back to Sima Park or any other suitable location where traffic is not so dense. I gave a report that I've been working with the city clerk's office. We've been reviewing all of our election sites, or particularly all of those that are not currently located in city buildings. And have identified some very promising candidates, particularly in our school system, for relocating some of those polling sites. And we have also already taken our first steps by working with the superintendent to get all election days declared or set as professional development days, so that the schools will not be in session on those days, leaving it open for election activity without any, scheduling conflicts or anything of that nature. Was there anything you'd like to add, Madam Clerk?
No, that was it. I just think it'll be very beneficial to have them back in the school buildings where they're ADA compliant. There's staff, custodial staff on hand if there's a situation. There was a couple of things Betsy and I had to go to St. Bernard's and pick up some things. Yeah, they're just situations that arise. So I think to have them in the public building where there's custodial staff, then they're ADA compliant, there's parking, there's outdoor lighting, there's all of these things that the rental places don't all have that we really need in our election facilities. And I think it's beneficial for the voters to see what monies we're asking for is there in the buildings, and seeing, oh yes, that gym floor is horrible, and those bathrooms, and they're seeing what we're spending this money on.
Rather than reading off the whole report and then going for comment, I know Councillor Fleming had been waiting to speak on this item, so I'll go to you now.
Yes, I want to thank the city clerk's office for doing their due diligence. But I specifically put this petition in last December to have this polling location changed for this particular election. This is going to be a mess down there. And mark my words, something is going to happen. And I want to put on record that I had submitted this to have this done for this particular election. I think it's great that we're going to put all the polling locations in schools, but I put it in for this particular ward. And something is going to happen. It's going to be crazy. There is traffic. It's just a mess. It's just a mess, and I pray that nothing happens this November. Thank you.
Thank you.
Now, any other counselors who have comments on that item, I'll just ask you to hold until we're done the rest of the report, but I wanted to give the sponsor a chance to weigh in. So 09824, Councillor Kuchar on behalf of the Shea Street Neighborhood Group to initiate a temporary moratorium on large-scale solar farms until such time as the zoning changes be voted on and approved. We had one recommendation from the planning board for an amendment, which simply changed it from a moratorium with a hard endpoint of May 31st to May 31st or when the zoning changes go into effect, whichever comes first. Otherwise, that passed unanimously. 15724, Captain Christopher Garcia, Fitchburg Police Department, for a new city ordinance aimed at enhancing safety on our streets and addressing quality of life concerns in our community by regulating the use of recreational vehicles on public and private property in Fitchburg. That was reviewed and looked good. Everyone was unanimously in favor. We did propose one amendment, which was to add in the definitions section. It says any wheeled vehicle. We added the words "or treaded." I'd actually like to ask the council if we can have an additional amendment, because we were informed between meetings that the term should be tracked rather than treaded to properly identify the concept that we were going for. But I'll ask for that at the end of the report. And lastly, 15824, Councillor Boschman and Jeffrey Bean to rename Oak Hill Road Bridge to the Ron Anson Bridge in honor of Mr. Ron Anson. That was unanimously favored. Now, any questions, comments on the overall? Councillor Fleming.
I am going to vote for this, but I just want it noted that several of the councilors that are voting in favor of this voted several years ago to not name public buildings or roadways or anything against for people. And now we have brought this forward, and like I said, I don't have a problem with it, and I'm going to vote for it, but I just want that noted.
So, Councillor, as one of the people in question, I'd just like to note that at least for me, the objection at the time was not to naming anything for anyone, but naming a unique and central public building, specifically this one, after one individual, not any particular individual, after any one individual. But at the time, for my part at least, I specifically noted that we had roadways and bridges and squares and intersections, all of which would be appropriate to dedicate to the memory of prominent public servants. But anyway, point is taken. Any further questions or comments? Councillor Schultz.
I had a question, just a clarification on 09824.
Yep.
You said that it's going to be May 31st of 2025?
Yes.
Or the zoning changes? Is that enough time to get the zoning changes enacted?
Should be.
Should be.
Honestly, I think we can do it faster than that, because this isn't a major zoning overhaul like some of our past zoning projects has been. This is a change to one segment of the zoning code, and we already know what we're trying to do with it. So I anticipate it'll be faster than that, but I think at the very least we can get it done by May 31st.
Do you think we should have a concrete date, maybe extend that to make sure we get it done?
We certainly could extend it out further unless there's some statutory reason that we can't.
Maybe the end of the fiscal year or something, maybe June 30th?
No, you can certainly change the date, but you do need a hard and fast date or earlier as the amendment from the planning board, so.
Because I just remember how long it took the other zoning changes to get enacted.
I have no objection to that. Councillor Kuchar?
I was just going to say, in response to Councillor Schultz's issue with that, we could always just extend the date just by filing a simple petition to extend the moratorium date past the May 31st to whatever date that we may, finalize the zoning. So I think I get your point, but I think we can extend it if necessary.
All right. Any further? Councillor Green?
On 15724.
Yes.
My understanding with reading it from Officer Garcia's point of view is this was, and again, maybe correct me if I'm wrong, this was aimed at the riders who are riding unregistered, unlicensed dirt bikes, motorized, one step up from an e-bike on public roads, causing a hazard not only with traffic, but the fact that they are unlicensed and unregistered, that if they were to hit my car, I would be the one that would have to pay for all that because they're unlicensed and uninsured, because neither one of those exist in those motorized vehicles that we're hopefully specific in addressing. So I just want to make sure that's the intent of this, and it's not for the ATVs or the other track vehicles that are on people's private property as recreation.
That is my understanding as well, and I'm actually looking at the text here. Nearly every one of the prohibitions ends with the words, while operated in any public space. The only exceptions are things that should be universal. The operator of any recreational vehicle shall not operate such vehicle with a passenger if designed for a single rider. That's just unsafe, whether you're on private property or not. But everything else is all in public space. It doesn't prohibit what you do on your own property or on someone else's property with their permission, or anything of that nature. It is aimed solely at public reckless use.
Okay.
Anything else?
Make a motion that we amend 9824 to amend the previously adopted amendment in committee to tracked from treaded.
That'll be 15724.
Oh, yes, my apologies, 15724.
Second.
All right, I have a motion to amend the previously amended text to change the word treaded to the word tracked. Any objections? All right, the amendment passes unanimously. We now have the full report of the Legislative Affairs Committee before the Council.
Motion to approve.
Second.
I have a motion and a second. Any objections? All right, report of the Legislative Affairs Committee is approved. We have 4 finance orders that, unless anyone objects, I'll waive the reading and they will be referred. 17124, I have a request for suspension of the rules. Order that the City of Fitchburg hereby approves the expenditure of grant funds from the UMass Memorial Health Determination of Need Grant Tier 2 in the approximate amount of $30,000 to support equipment purchases and all efforts and collaborations to start the North Central Free Medical Program. Can I have a motion for suspension?
Move for suspension of the rules.
Second.
I have a motion and second for suspension of the rules on 17124. Are there any objections? Seeing none, it is before the Council.
Good evening, councilors. Thank you so much. Director Curry wasn't able to make it this evening, so I am here in his absence. I hope I fill his shoes. I will hold until you guys have any questions because I believe we discussed in detail the last time a very similar grant went in front of you. So if you have any questions, please let me know and I'm happy to discuss.
Councillor Green.
Yes, my only question is, are you able to identify at this point what exactly the free medical program will entail? Like, who will be able to access that, and what does that mean for free medical program?
Yeah, definitely. So we won't be restricting patients from receiving services at the program based on income, insurance status, if they have a primary care physician or not. The thought is if they are presenting to the program that there is a gap that they need served. And so we intend to not restrict patients to receive services, rather serve their needs and determine what the gaps are and work to address those. So for example, if the patient is insured, but they do not have a primary care physician, then the plan would be to connect them with a primary care physician to receive long-term permanent primary care in the future. Does that answer your question?
Where specifically is this program going to take place?
Yep, so it's going to take place tentatively at St. Joseph's Church in Fitchburg. I know we have a couple of counselors that are excited about that.
That's my ward.
I definitely wasn't talking about Councillor Boschman.
We all end up talking about Councilor Boschman. Doesn't matter of time. Right.
We do have an agreement that is tentative with St. Joseph's that has not been signed on their end or on our end yet. So this is still tentative at this point, but that is our intention, and it seems as though it will be moving forward in the same space at St. Joseph's that is used for a polling space.
So not only did you identify that you were going to need medical equipment,
yep,
but then any and all efforts to get that up and running. So $30,000 a year's worth of service, 2 years worth of service?
Yeah, great question. So this is something that will be much more expensive to get started, and then maintaining it in the future will be much less expensive. So for example, by nature of being in a church basement, there are not exam rooms located in a church basement. So something that will be purchased to help get the clinic up and running is tall and sort of heavy-duty privacy screens to make exam rooms. Now, this is not something that we will need to buy privacy screens every year. Once we buy them, we have them for forever. And so the only reoccurring cost that is factored into this grant is cost for interpretation services. We do intend to have volunteer interpreters on site for the languages that we expect to have patients presenting to us with a need. For example, off the top of my head, English, but we wouldn't need interpreters, Spanish, Portuguese, Haitian Creole. But if a patient comes in and speaks a different language, which is not those three, then we would require using an interpreter, and that is charged per minute. And so I factored in, I believe it was $3,000 to pay for those interpretation services should they be needed. I'm not sure we will need that much, but I wanted to make sure that it was budgeted for and accounted for just in case.
Great, thank you.
Councillor Brochman.
What's the hours going to be?
So, and this is tentative again because the agreement with St. Joseph's is not signed, but for all purposes, including our clinical partners, the second and fourth Tuesday from 5:30 p.m. to 7:30 p.m., and that was designed intentionally to be accessible for patients who are working, during the day and aren't getting out of work until 5 or 5:30.
All right.
And if anything changes, I'll let you know, but it's looking like hopefully we're all set with that.
Councillor Fleming.
I wasn't sure if I heard. Did you say this is just for Fitchburg residents?
So we're not going to restrict based on residency. This is, as many of you know, my position is regional, so I'm responsible for all 13 communities in the Montechusett Public Health Network, and Fitchburg is our highest need community, and so I expect the majority of our patients to be from Fitchburg. but we aren't going to turn away based on residency. But like I said, I based on my previous experience elsewhere, doing other activities in the city, I would expect it to be majority Fitchburg just because of Fitchburg's needs.
Well, I guess, will you be marketing this outside of Fitchburg? I guess would be the better question.
Yeah, good question. I would say the only place that it will be marketed to outside of Fitchburg, perhaps, would be the Leominster Public Schools. As I mentioned, my position is regional, and I'm also responsible for their residents, and so their school kids is what the need might be for routine pediatric immunizations that are required for school. But again, in the past, the need from other communities has been significantly less than Fitchburg, unfortunately.
Is this the program that Leominster chose not to?
No. No, that's a different, if I know what you're talking about, this is not it.
Okay, thank you.
Councillor Cruz.
Thank you, Mr. President. How long do you anticipate this money going for? How long do you think it'll extend for?
Yeah, sure. So like I mentioned, the majority of these funds are budgeted to purchase equipment. And so it's all going to go pretty quickly when we purchase our equipment if these funds are approved by the council. And following that, the reoccurring expense is the interpretation services. Like I said, we're going to have interpreters on site for the most commonly needed languages in Fitchburg, and I don't really expect to see a lot of patients speaking a language that is not English, Spanish, Portuguese, Haitian Creole, so I think it should last us a while.
If you don't have a date, that's fine. I'm just curious.
Yeah, it's for a one-year period. The grant is for a one-year period, but like I said, it's for equipment, so we're probably going to spend it pretty quickly.
I just think about all the reusable things that you have to continue to buy, gloves and things like that.
So things like gloves, like if we buy, okay, so for example, like our immunization clinics that we run at the health department, if we buy a case of those, that's going to last us a really long time. Like we have cases of gloves that we bought, 2 or 3 seasons ago. It's going to last a while. And so once we buy something, it doesn't go through very quickly. And then the things that we do buy that are reusable, like a privacy screen, for example, we will have forever and could use for other purposes also if we needed to.
Okay. No, I think it's great. I'm in favor of it, especially when you look at, like you said, the need. There's a need here that needs to be filled when you look at our for-profit institutions really failing across the state and choosing profit over people. So I appreciate it. Thank you.
Thank you. I appreciate it.
Councillor Kucher.
Thank you. You said that this is more of a regional issue. You're going to be marketing it to Leominster residents. Are there going to be Gardner residents as well that this will be marketed to?
Yeah, great question. It will be accessible to residents from other towns if they need to access it. We're not restricting residency, income, insurance status, if you have a primary care. If a patient needs something, then their needs will be served. But like I said, in things like this in the past, especially with this particular topic, Fitchburg generally has the biggest needs, and so for example, I wouldn't expect a Fitchburg resident to show up at the clinic and not be able to be served because there's, 60 Leominster residents. I don't think that will happen. It's just...
Well, the reason for my question is,
definitely.
Are you going to other communities to ask for $30,000, or are you just concentrating on Fitchburg to provide the funding?
Yeah, so I don't think...
This is a grant, right? This is not coming out of the general fund.
Okay.
And am I correct in assuming that the nature of this grant is such that if we didn't spend it on this, we wouldn't be getting it?
That is correct. So this grant is through the Determination of Needs Funds through UMass Memorial. And so essentially they have specific needs that they have identified in the region. And one of them is healthcare access. And so in order to be eligible to receive these funds, the applicant had to be serving one of their specific categories that they have determined is a big need in the area. Healthcare access. Another one is maternal and child health, substance use. I apologize, I can't remember all of them, but that's just a few examples. And this was actually a pretty competitive application process. I think 1 in 4 applications were accepted. And so I'm proud of us as a team that we were able to secure these funds, should the council approve it, to serve the needs of Fitchburg, particularly in our school system. That's the inspiration for this project.
Do we know what criteria they use to determine that?
Just a moment, Councillor. I was just nodding to acknowledge that I had seen your hand. Are you all set, Councillor Kuchar? Councillor Boschman.
I hear you talk. If I go in your clinic and I'm sick as a dog, and I need antibiotics, will you be able to prescribe the antibiotics there?
The providers will write a prescription, but we obviously do not carry controlled substances at St. Joseph's Church, and so you will have to go to a pharmacy to pick up the prescription.
Oh, I understand that.
Yeah, and if you are, if you have an acute issue, such that may require emergency care, for example, this is not intended to replace the emergency room or, in some cases, urgent care. And so just to be clear, the intention of this program is to serve as a pathway into permanent medical care for any residents that have gaps. And gaps may be something like health insurance enrollment, maybe something like enrollment with a primary care. That's a big issue right now, especially several practices in the area have closed recently. And we have a lot of kids or a lot of adults even that have health insurance but just cannot find a primary care. And when there's something you need, for example, immunizations for school, and you can't get into a primary care, that causes a lot of issues. And so we have a resource coordinator who will be triaging these issues with patients and connecting them with the resources they need. So in short, this is not intended to be a patient's permanent medical care. We don't want a patient's permanent medical care to be in a church basement. It's intended to serve their needs while we get them what they need to have in the future.
To my fellow councilors, I can honestly tell you something right now.
Councilor.
Oh, okay. Well, I'll get to the chair, who can relate to my fellow councilors. I agree with her 100%, not because of things in my ward, but being a senior citizen. It seems like the health care in this Commonwealth has gone down. I can't say the word on FATV, but it's really bad. And I can honestly tell you, being a senior citizen, I had a doctor by the name of Dr. Ed. He's leaving. He's going down to the Cape. Now I got to hunt for another doctor. I had 3 primary care doctors within a year. 3, because they got out of practice. It's very hard for an elderly person to find a doctor, not just the kids, because we're still alive. I know the government wants to get rid of the elderly because we're a border. But sure, I'll just tell you, and that. But the elderly have a hard time getting insurance, finding doctors. They're very hard to find. And if we're all worried about Leominster and Gardner and Sterling and Pepperell and Aldi, you really think that I'm going to drive 25 minutes to come from Gardner, Massachusetts, to St. Joseph's Church and hoping they'll be open past 7:30, or make it by 7:30, and they're only open from 5:30 to 7:30? Really? I think it's just going to serve the people of Fitchburg in our area. I don't really think you're going to get that many clients from Leominster, Massachusetts, when you get so many urgent care buildings right there. Really, in my honest opinion. I don't think.
You're welcome
You
to
know
come
more
to
than
the
me.
clinic, counselor,
Huh?
if you don't have a primary care. I said you're welcome to come if you don't have a primary care. I'll see you
I
there.
got one, and this doctor doesn't want to lose me. He says I'm the best.
He obviously needs help.
But anyway, I just want to say that, and I'm glad you didn't. And I really believe, I want to know one thing. I pop in at 7:29. Are you actually going to stay to 7:30, or you'll see patients right up to the end?
That's a great question. That question is probably best answered by our clinicians. That is something I have not thought about yet, to be honest, because we are not quite there, close to opening. As you know, we don't have all of our equipment yet. So I can ask next time, and I just had a meeting today with our family medicine provider and talked with her in 2.5 hours and did not ask that. But next time I can ask her what her thoughts are and let you know. My experience from visiting other similar initiatives is that there will be cutoffs for certain services or cutoffs for, like, for example, if there's 20 patients in the waiting room at 7 o'clock and all of them need physical exams and we have 5 doctors, like, it's going to take them a little bit to get through that, and they'll be there until 10 p.m., you know. So I think that's going to be at the discretion of the clinicians, though, and that's probably a better question for her to answer.
And my other question, if this thing takes off and it's a great success, are you planning to have more hours, more days? Like this is the second Tuesday every month? So that's really once a month?
So it's the second and fourth Tuesday, so two days a month. And originally my thought actually was 1 day a month. And based on the advice of the clinicians that we're working with, we adjusted it to 2 times a month because the thought was if they are having an issue that's not quite acute but sort of chronic, that it shouldn't wait another whole month if the Tuesday just passed. And so that's the reason why we adjusted from 1 to 2. If it is successful and there is a significant need, then I would be open to adjusting either to operating a little bit longer or having another day a month. I am trying to be cognizant of our volunteers because the physicians and nurses and et cetera are volunteers, and we need to have them at the clinic. And so if we cannot staff the clinic another day a month with the appropriate number of clinicians, then, you know, it won't be possible. But if there is a need, then I'll try my best to work it out. But we're not quite there yet, fortunately and unfortunately.
Okay, I yield the floor. Thank you.
Thank you. Councilor Schultz.
Yeah, I just had a question
Sure.
about the staff. And
Yeah.
what you anticipate the staff looking like, the volunteers. You mentioned the doctors and the nurses and so on. What will be there for people when they come?
Yeah, definitely.
Given Tuesday.
So we'll have a full set of clinicians ranging from nurses to physicians. Physicians, no specific specialty. We may have family medicine. We may have pediatrician. We may have, you know, a different specialty.
So you haven't really lined anyone up yet?
So I can say for sure that we have 2 groups we're working with. In the past, we have worked really closely with Fitchburg State University. They have a really great nursing program, and we have utilized them in the past for our immunization clinics. It's a great experience for them to get comfortable with administering immunizations, do other things like working with patients at admin, taking vitals, et cetera, et cetera. And so we have an agreement, which I believe has not been signed yet. I'm not totally sure. I think it has not been signed, but we're working on it. And then the other group that we're working really closely with is the, I hope I don't miss a word, UMass Fitchburg Family Medicine Residency Program. I think I got all the words there. And so there are 16 family medicine residents that are training in the family medicine residency program, and they will be working with us at the clinic, again, pending an agreement that is out and about right now, waiting for signatures on both ends. And also the attendings at that practice will be working with us as well. I don't know off the top of my head how many attendings there are at that practice, but they'll be rotating through with us. And then we'll have clinicians from elsewhere also. We have a sort of volunteer onboarding packet type of situation involving things like a Cori check, for example, that's being put together and is not quite ready yet. So I can't put out for volunteers until that is done. And so that's the reason why I can't tell you, all right, we have, 10 physicians and 6 nurses, whatever. But once that's done, I'll be working on that next.
Well, thank you. That gives us some idea, Victoria. Appreciate it. I yield the floor.
Councilor Fleming.
Yes, I certainly don't want to deny my fellow counselor his health care. What criteria do they use to determine that we are a high need area? We have community health connections. We have the satellite community health connections. We have urgent care. We have the hospital right next door. So what criteria is being used to determine this?
Yeah, that I don't know the exact criteria of the determination of needs process off the top of my head. So I don't think I should speak on it because I don't want to speak incorrectly. But I can refresh myself and read back up on it and then get back to you if that's okay.
I would appreciate it.
I just don't want to speak incorrectly, so I'm not going to try to make any guesses.
Because it usually seems that Fitchburg's always the high need area.
Yeah.
And I don't understand that.
Yeah, there's definitely, we're fortunate to have Community Health Connections. They're a great partner of ours. Several other family medicine practices in the area. We also just lost, Burbank. I don't know if I should say that word in this room. That that fires a lot of people up. And there's so much need for healthcare that it just there's more capacity, that there's more need than there is capacity, even though we are fortunate to have so many resources like CHC, for example, a community health center right here in Fitchburg.
I would like a guarantee, though, that, and I hope you can give this to me, that Fitchburg residents are put priority before anybody from out of town. Since we are hosting it and, we are the high need area, I would hope that Fitchburg residents will be prioritized.
Yeah, definitely. Are you able to tell me more about what you mean by prioritize, just in terms of logistics on how that would work on the ground at the clinic?
Well, I guess you would have to tell me. If somebody's from Fitchburg, and then you have somebody coming in from Gardner, that the Fitchburg residents would be the first to be seen or get their medical needs, depending. If it's an emergency, they first of all shouldn't even be there. They should be at the hospital.
At the emergency room, exactly.
But I would hope that, Fitchburg residents are prioritized.
Yeah, I don't want to give a guarantee just because I haven't thought about it yet, and so I don't know how it would work in practice, and I would want to talk with our clinicians especially about how exactly that would work and what that should look like. I will say I will definitely talk about that with them and do my best to figure out a plan. I just don't want to guarantee because I don't want to make all the decisions on my own by myself standing here. So I think others should be involved in thinking about what that could look like and what the process would be, et cetera, et cetera. So definitely noted, and I will bring it back to all of our folks that are working on this and see what we can come up with.
And if I get some kind of feedback on that, I would appreciate it.
Yeah, I can do that. I will say that our physician that I mentioned, I work with her really closely. She is on vacation for the next 2 weeks, so it's not going to be within the next 2 weeks, but just so you're not waiting, so you know.
Councillor Walsh.
Thank you, Mr. President. I would just like to remind people that these funds are being expended to start the North Central Free Medical Program, not the Fitchburg Free Medical Program. So although I understand that it's us making this decision, it's a regional event. I mean, it's a regional thing. So, thank you.
One thing I try my best to keep in mind is that these issues do not have borders, and perhaps a Leominster resident one day will be a Fitchburg resident. And if there is a need, for example, an infectious disease, which that is not something that we will be triaging. If somebody has an infectious disease, they need to go to the emergency department. But if somebody has an infectious disease, they don't care where the border to Fitchburg and Leominster is. So I try to keep that in mind when I am working on those initiatives and try to be compassionate about the needs of, everybody in the area that I'm responsible for, and not just Fitchburg.
All set? Councilor Cruz.
Thank you, Mr. President. First, I want to applaud the gentlelady from Ward 5 and the gentleman from Ward 3. Their desire to serve residents of Fitchburg is just born out of their love for this community and its residents. So that's really how I'm seeing that. But I would encourage them, Mr. President, to consider that geographically Fitchburg residents are going to be prioritized because it's going to be at St. Joe's. So immediately they're going to get, they will be prioritized. But also, I want to encourage everyone, I guess, to consider this as an opportunity to see kind of a return to community health care versus these giant conglomerates that we're seeing failing across the state because they're not making enough money. It's an opportunity for us to help our community, in our community, through our community. And we could be leaders. We could be pioneers and leaders North Central. I yield the floor. Thank you.
Thank you. One final comment from me, I think, unless there's someone else who's waiting to speak still, am I correct in interpreting that this project is not being funded through the general fund? Not just this appropriation, but in general. Is this being supplemented by general fund monies?
No.
I didn't think so. So I'd just like to encourage, I'm here because of Fitchburg. I've made it clear on many occasions I'm not here to represent the best interests of the citizens of Leominster or Gardner or anywhere else in Massachusetts, despite the fact that many of them are people I know and like. But this is, Fitchburg is not putting money into this. We're the grant administrator for this. This is state money. We're just voting to accept it and spend it on behalf of the region. So I think that we absolutely will see a vast majority of utilization coming from Fitchburg, just both because of need levels and because St. Joe's is not really the easiest place to get to from outside of Fitchburg. You can't just hop off Route 2 and wind up at St. Joe's. But even if, hypothetically, 1 year were utilized primarily by out-of-city residents, it's no skin off our nose. It's not costing us anything. It's not, if anything, we're bringing people into Fitchburg to, who then will be at least seeing the city that they might not otherwise have seen, maybe spending money here, maybe not if they're going to a free clinic, but at the very least, we're getting people into the city, and it's not costing us anything. This isn't taxpayer money that we're expending that's then going out of the city to benefit non-residents. This is state money that we're just approving. So I think this is a good thing. I think that I hope it's very successful. And, if it came down to the point where we were being asked to supplement this from the general fund, then I would want to see the utilization numbers and see, is this actually going to be of primary benefit to the citizens of Fitchburg and so on and so forth. But that's not an anticipated ask down the road right now.
President Zarella, I just, sorry to interrupt. I did want to say I'll be keeping track of all the patient, I don't want to use the word demographics, but essentially there's the zip codes they're from. And so once we get this going, I'd be happy to provide that to you all so you guys can see where our patients are coming from, what percentage are from Fitchburg, how many patients we're seeing, et cetera, et cetera. I expect initially our patients will be from referrals from the Fitchburg Public Schools, because this is a new thing. Folks don't know about it. And this is a very high need time for our public school system. The kids are just starting school for the year, and they have a lot of things that they need: immunizations, school physicals, lead screenings, things of the like. And so I expect that initially we will be seeing 85% pediatric patients from our school system.
Thank you. Before I go to Councilor Schultz, I know the mayor had indicated she wanted to weigh in on this.
Thank you, President Zarella. I just wanted to add that you're correct. This is not coming from the Fitchburg General Fund. And in addition to that, the General Fund is actually being supplemented by the Montechusett Public Health Network for any incidentals. For example, our city solicitor is working out an agreement for use of the space that the clinic will be at, and those incidentals are covered by, the money that the MPHN is putting into the General Fund. And I even discussed this with the auditor. Is this enough to cover? And she confirmed it absolutely is. So, thank you.
Thank you, Madam Mayor. Councilor Schultz.
Yeah, that was the question I had as far as the network. The grant administrators, are you volunteering your time, or is that coming from the network to be able to have this program? I mean, it's because you and other health department employees are going to be involved with this program. So. Yeah,
it's a lot of work for sure. My salary is 100% paid by the Public Health Excellence Grant, which is the regionalization grant for the Montechusett Public Health Network, and so my time spent is charged to that grant, and that is also why, in good faith, I cannot restrict this clinic to be only for Fitchburg residents. The other towns are paying for my time essentially by nature of being part of this grant, and so that's one of the reasons why, if they have a need, which not all the towns do. For example, thinking about my 13 communities, Princeton, off the top of my head, Princeton residents may not need to benefit from a project like that, and they may benefit from some other type of project. So each town has different needs, and each town has to be served in different ways, and this is something that this project came from my experience of working with the Fitchburg Public Schools. That is why I started this, because I recognize that there is such a gap in the area, especially for our school kids, that we really need to do something about.
Because that's always been a question by some of the constituents of when we accept grants, where are the city of Fitchburg employees, where is that money coming from to administer the grant? So there's always costs associated with it, and I was just wondering, in this case, because you talked about a lot of the volunteers, the clinicians that are going to be volunteers, so I was just wondering about the grant administrators as well.
Yeah, so a part of the Public Health Excellence Grant, as Mayor Squalia mentioned, is an agency admin fee, and so the city is compensated for any costs that might have been incurred by the city that we can't necessarily budget for in a grant. Like, for example, HR time, legal time. I can't think of anything else off the top of my head. We have a clerk budgeted into our Public Health Excellence Grant, so that's already paid for. She does our payroll, all that kind of stuff. So, yeah, I hope that answers your question.
Yeah, thank you, Victor. I yield the floor.
Councilor Green.
Questioning the relationship, going back, asking for UMass. I know this is Tier 2, but what's the next step after the $30,000 is spent? And whatever time frame that is, what's the step of going back to UMass asking for either more money to continue this program, or the next step? What's going to be the next step for longevity of this if it is successful and there's always going to be a determination of need?
Yeah. So the determination of needs funds, I do not know what the balance is currently, because they just expended $300,000 for Tier 2, so our $30,000 is part of that, and an additional amount of funds for Tier 1, and I'm not sure what that subtracted from the remaining balance, but it is a set amount of money that eventually will be gone. If there is another grant cycle, I will definitely write another proposal. If we have additional financial need for the clinic for one reason or another, but outside of the determination of needs process, I would expect UMass Memorial, Health Alliance, Clinton Hospital, whatever you would like to refer it as, Leominster Hospital, to be very supportive of the clinic moving forward. They have been really great thus far. I've been working with them really closely on this for several months now, and even formalizing the partnership between us and the Family Medicine Residency Program is a really huge thing for us because we cannot do this without physicians. I cannot run this free clinic as myself. And so I think that moving forward, especially as the clinic takes shape and they start to see how things are working, what we think our needs are, what they think our needs are, I think that they will be supportive of other needs that we might have that are not financial, like, for example, staff. And so I do think that they will be supportive of us moving forward, whether it be on the financial end or some other need that we have.
And who is bearing the cost of maintaining the facility during non-working hours? I'm thinking we're already into September. Snow is going to be here before we know it. I'm thinking about St. Joe's itself and like who's going to maintain the sidewalks and the parking lot across the street to house everybody, and is Mart Bus providing, how are they going to do that curb to curb safely?
Through you, Mr. President, the lease addresses that, and I don't have it off the top of my head.
Okay.
The lease is going to address the responsibility for the sidewalks and maintenance outside the time period.
City of Fitchburg, grant, all through the grant.
Yeah, I think it's the facility. I think it's St.
the
Joseph's.
facility.
It's not.
Yeah.
I'm almost positive it's not the city, but I don't have the lease in front of me, so.
Yeah, I am like 99% sure that it says that St. Joe's will be maintaining their space as they do. We're using it 2 times a month for 2 hours, so that's not going to change how they do things. They're going to be utilizing it for other things that are not the clinic. For example, polling coming up soon for voting, or other things that are happening down there. They have like
Food pantry.
a food pantry. They do some types of classes down there. There's all kinds of community initiatives. And so, yeah, we won't be responsible for maintenance, electricity, anything of the like.
Okay, thank you.
Thank you.
I could get you a copy of that agreement, too, once it's signed.
Oh, I'm sure it'll all be public. Yeah, I mean.
Yeah. Oh, yeah, it definitely will be, but I'd be happy to send it to you directly if that's easier.
Make a motion, we accept.
Second.
All right, do I have objections? Seeing none, it is unanimously approved.
Thank you, counselors.
Thank you. We have a small number of petitions. 16624, Liz Murphy, to amend Chapter 44 of the City Code to add the following position: municipal hearing officer, pursuant to General Laws Chapter 268A, Section 20B. That's going to Legislative Affairs. 16724, President Zarella, to designate the Veteran Services Commissioner as a special municipal employee. That's going to Legislative Affairs. 16824, Councillor Kuchar, on behalf of Paulo Fritz, to investigate water runoff from the property of 160 Stickney Road for the placement of an apron and berm. 16924, Councillor Boschman, on behalf of Kyle Glennie on Hurd Street, to install a berm that has deteriorated over the years. Those will both be going to Public Works. We have one item of other business, which I'd like to take under suspension of the rules if it's agreeable to the council. Parcel S124-24-0 on Alpine Road. The private owner is looking to sell. The city has a right of first refusal from, I can only assume, a prior deed. Sorry?
Chapter 61.
Sorry, Chapter 61. Thank you for refreshing my memory on that. And so we need to waive our right of first refusal to allow them to sell. Is there anything you'd like to? Oh, well, first I should ask for suspension on this.
Motion to suspend.
Second.
Any objections to suspension? All right, it is before the council. Madam Solicitor, did you want to?
I have nothing.
Do you have anything? Okay. I see Councilor Kuchar scowling at me.
Is this by the radio towers?
I believe, but I haven't gone out to.
Because I'm just trying to think of what the city would have, some sort of right of refusal. The only thing I could think of about up there are the radio towers.
Yeah, Vice President Van Haziger reminded me it's not a deed issue, it's a Chapter 61.
Okay.
Madam Mayor?
So yeah, this is on my desk. It's, I don't remember the exact specifics, but it's Chapter 61A. It's, so they are requesting that they take it out of that status. They need our permission. And I believe in the letter it says something about building a number of units of housing. I haven't discussed this with the assessor yet, so I haven't had that conversation yet, but it is on my desk.
All right. Further questions from council? Councilor Green.
I mean, if the mayor hasn't acted on it and needs to go through several departments, what was the need for suspension of the rules if we weren't going to act on it?
So that was actually my call because I assumed it was going to be very straightforward. The issue is with a right of first refusal, our only choices are waive it or purchase the parcel ourselves. Right. And since we are not in a budgetary position to be purchasing a parcel that is currently empty and that we have no plan to do anything with, and since the mayor indicated no intention of appropriating funds to purchase the parcel, it seems like it's kind of a pro forma vote that we need to take. So I didn't see any purpose to ask Councillor Cragen to convene city property just to take up this one item.
Thank you.
Oh, and I appreciate that. I'm just, so all we are doing is giving up the right of first refusal on this property so that the powers that be can continue to move forward with if it's going to be developed, if it's going to turn into some other development, whatever. That's all we're doing, correct?
Madam Solicitor?
So if I could, under Chapter 61A, so they have a special tax status, and in exchange for getting that tax status, they have to come back to the city and say, we want to sell it, we want to take it out of the restriction under 61A, which is agricultural restriction, and we have a bona fide purchaser, and so or not having a bona fide purchaser, you just give notice several years in advance, but if you have a bona fide purchaser, then that's the price that we want. You have to pay that price or more, and you have 120 days to make that decision. So the right of the city is to say we want to exercise our right of first refusal and purchase it for fair market value or an arm's length transaction, or not. Those are the two choices. And then when it gets taken out and sold, there's a rollback on the taxes that have to be paid to the city.
So to answer your question directly, Councillor Green, we're not voting on what can actually be done with the parcel tonight. We're simply voting, we're being asked to vote, rather, that we will not exercise our right of first refusal, that we do not intend to purchase the land ourselves. That's the only decision that's on the table tonight.
That's correct.
Okay, thank you.
Any other questions, Councilor Van Hasen?
I do just want to highlight something that Attorney Mead referenced, is that this property has a special tax status that lowered the property taxes the owner was paying. By leaving 61A, the property's tax basis will go back to normal, so we will see an increase in property taxes. and we will receive several years prior property taxes that they weren't paying. So we will get a little bonus, we will collect more taxes on this, and we have no use as a city for this property, so there's no need for us to buy it. It just gives us protection so that if someone takes it out of 61A, the town or city or community can purchase the property, but we don't have any need for it, so there's no purpose to it.
Any further questions, comments? Any motion?
Make a motion, we accept.
Second.
I have a motion and second to waive our right of first refusal on this parcel. Is there any objection? Seeing none, it is unanimous. The next item on our agenda is an executive session pursuant to General Law, Chapter 30A, Section 21A, Sub 3, to go into executive session to discuss strategy in regards to the case of Bach Realty LLC versus the City of Fitchburg, SJC 13639, in which I have determined as chair that open discussion of this matter would have a detrimental impact on the litigating position of the city. I need a motion to go into executive session.
So moved.
I have a motion and second to go into executive session. I will note for the public that we will be returning to open session briefly following this to take a confirmatory vote. It will be, I will say it will only be about 2 additional minutes or so of council time, so if you don't feel like sticking around outside, there's nothing hugely exciting that won't be available on FATV afterwards, but we will be returning to open session. Is there any objection to entering into executive session for this purpose? Seeing none, I am now closing the session. I need everyone who is not either a member of the city government, well, anyone who is not a member of the city government pertaining to this matter to please clear the gallery. And unfortunately, I do have to ask everyone to go all the way out.
You say all the way out, outside?
Outside, yes.
Outside, outside.
Outside, outside.
No.
Right.
Take care, man.
We have to do the roll call first.
I mean, you might as well go ahead while we wait for everyone to clear out.
Oh.
And
Councilor
to
Fleming is
confirm
in
that
the
the...
restroom.
Sorry?
Councilor Fleming is in the restroom.
Yes, and also I need to wait for the mics to be cut. We took it by unanimous consent. Oh, we actually need to take it as a roll call. Okay. I forgot which exceptions there are to the unanimous consent. But all right, can I please have a roll call vote, Madam Clerk? Actually, yeah, let's wait for our councilors to return in that case.
Well, I had wrote a little something about the election that I missed in announcements.
Oh,
So while
okay.
we're on the air, I could tell the results and the status of what happened.
Sorry?
You want to do the roll call vote while you're still online?
Yes, so, okay, so we are still on air at the moment, Dan? All right, go right ahead.
Just to fill the time. So we did have an election on Tuesday. We had the state primary. We had, out of our 29,814 voters, we casted 3,278 votes, 11% went out and voted. At the polls, we had 1,898, and in-person early voting, we had 1,705, and 125 came actually in, and we had 1,705 vote by mail. So our vote by mail and in person is exceeding the number of people going to the polls, which was an eye-opener for us doing the results. And I would truly like to thank, because whether 29,000 people come and vote or 4,000 people come and vote, we still have to put on the exact same show. So I told everybody it was our dress rehearsal for November. Everything went wonderfully. Nobody received calls. Nobody called me with any concerns, thoughts. It was a really great day, and it went swimmingly. So I thank all my departments, everybody that supports the election group, because every city department really does contribute to that day.
And thank you. I always hear nothing but good things about the way the clerk's department runs the elections.
Good, thank you. Okay, everybody's back.
All right, we have everyone back. So my mistake, this is one of the very few things where even if we have unanimous consent, we still need a roll call vote. So we're going to take a roll call vote to go into executive session for the previously stated reason.
Councillor Green.
Yes.
Councillor Schultz.
Yes.
Councillor Van Hazinga.
Yes.
Councillor Walsh.
Yes.
President Zarella.
Yes.
Councillor Boschman.
Yes.
Councillor Kuchar.
Yes.
Councillor Cragan.
Yes.
Councillor Cruz.
Yes.
Councillor Fleming.
Yes.
Okay, passes by 10 members that are present.
All right, we are now going to go into executive session. Dan, if you could cut the mics, please. open session at 8:36 p.m. We have one item on which to vote, 17024, the authorization for appointment of special counsel, Vincent Pusteri and Kevin Powers, for the case previously discussed.
Motion to approve.
Second.
Special counsel.
Mr. President, I believe Mr. Pusteri is outside. I don't know if you'd like to address the council at all.
Sorry?
Is that
he's
Mr.
been here.
Pusteri outside? I don't know if you'd like to address us at all. It looks
be.
like him.
Sure, I mean, he,
Oh, I didn't even see him.
Oh, wow.
All I could see is darkness.
all right, so I have a motion and second for the appointment of special counsel. The appointment doesn't need to be a special
it does
roll
not.
call vote?
No, it
Okay.
does not.
So any objections? Seeing none, it is unanimous, and that concludes our business for the evening.
Make a motion, we adjourn.
All right, I have a motion and second to adjourn. Seeing no objections, we are adjourned.